Good afternoon, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Medical Officer of Health here in Peel, Darren Rizzi, our Fire Chief and Director of Emergency Management, and Sam Rogers, our Director of Enforcement. Before I give my update, I want to send my deepest condolences on behalf of myself and all the members of my council team to the family and the friends of the 5-year-old boy who was tragically killed yesterday by a driver while riding his bike. This is an absolute tragedy, and my heart broke when I heard the news. Any loss of life in our city is tragic, but the loss of someone so young is something so avoidable is particularly devastating. Today, our entire city mourns his loss. Mississauga is starting to feel a lot of hope about the COVID-19 situation facing our city. Of course, we can't let up on the measures just yet. We have to keep doing our part to stay apart. Last week, we received the news that the province's vaccine rollout is ramping up significantly. The accelerated rollout is a true game changer for Mississauga, Peel, and for the entire province. What this means is that right now, residents 18 years of age and older living in a hotspot zone, hotspot postal code, an FSA, in Mississauga and in Peel are eligible for the vaccine at one of our 5 mass vaccination centres. In fact, there are 11 in total in Peel, as well as at Trillium Health Partners. I want to give my sincerest thanks to the Government of Ontario, in particular, Health Minister Christine Elliott, Solicitor General Sylvia Jones, and of course, Premier Doug Ford, for making the vaccine available to more of our residents. We badly needed this. We needed clarity on when everyone would be eligible for the vaccine, and we needed hope. But the news for Mississauga gets even better. I am so thrilled to announce that starting tomorrow morning at 8 a.m., all residents 18 years of age and older, regardless of where they live in Mississauga and Peel, will be eligible for the vaccine. That's right. All people 18 plus, regardless of your postal code, will be eligible for the vaccine here in Peel Region. I'm going to say it again and again and again because it makes me so happy. We will all be eligible for the vaccine as of 8 a.m. tomorrow. This is important because a handful of the postal codes in Peel, most of them were in Mississauga, one of them were in Caledon, were not considered hotspots by the province, yet they had higher case counts and higher hospitalization rates than some of the other identified hotspots in other regions. All the information to book will be available tomorrow morning at peelregion.ca/COVID-19 vaccine. Click on Book Appointment once you're there. If you cannot access the internet, please call the Region of Peel vaccine line for help with booking. That number is 1-888-999-6488. And please remember that those 18 plus in hotspots are already eligible to book right now through the provincial booking system. I really want to thank Dr. Lowe and his team and all those people involved in making the vaccine available to every adult in Peel Region who wants one. I want to thank Dr. Lowe, Peel Public Health, our hospital partners for everything they have done over the past 14 months to help us navigate the pandemic and to keep our community safe. The reality is that we couldn't wait any longer to make that vaccine available to every adult in Peel. Peel Region has been a hotspot for a very long time. In fact, we've been on fire. We're home to 10% of Ontario's population, but account for 20% of all cases. We're home to the largest number of essential workers living in every single corner of this region. And these workers have shouldered a disproportionate amount of the risk through the entire pandemic, by going into work day in and day out to make the products that we needed to get us through the pandemic. They went to work so that the rest of us could work from home. We now have a clear path to getting all of our essential workers and all of our residents vaccinated. Dr. Lowe has assured me that more appointments are being added every day at our mass vaccination centres. It might take a little while to secure your appointment online, and we are asking everyone to please be patient when you're trying to book. I'm also encouraging everyone to book their vaccination as soon as they possibly can. Getting the vaccine is the best way to protect yourself, your family, your coworkers, and the entire community. Please don't turn down this opportunity. We are hearing reports that some people are intubated in the hospital because they turned down their first chance at a vaccine, hoping to secure a different vaccine of a different brand. I call this vaccine shopping, and it's incredibly dangerous. The next available vaccine is the best vaccine. All vaccines are safe and approved by Health Canada. Once again, all residents 18 plus in Peel will be eligible for the vaccine starting tomorrow at 8 a.m. So please, book an appointment as soon as you possibly can. Over the last week, we've seen a number of pop-up clinics roll out in Peel, targeting our highest risk residents and those least likely to get vaccinated at one of our mass vaccination centres. We saw a huge uptake in registration at pop-up clinics at the MAC Islamic Centre of Ontario and at the Brampton Islamic Centre, with appointments filling up in about 2 hours. We also saw a great turnout at our one-day pop-up at the Muslim Nexus Neighbour on April 29th. Peel Public Health is planning to launch more of these in the coming days, targeting high-risk residents, including one in Malton on Friday. But because we're using pop-ups to target specific groups, these pop-ups are not being widely advertised. This approach ensures that our most vulnerable are able to access the vaccine through the pop-ups while offering a smooth and efficient option for the general public at our mass vaccination sites. We've also seen employer-run clinics roll out at both Maple Leaf and Maple Lodge Farms. And 2 separate pop-ups are administering vaccines today at for Amazon employees at facilities in both Brampton and Caledon. I want to thank the province for announcing today that it will be partnering with Peel Public Health over the next month to set up even more workplace vaccination clinics across the region, including at Loblaws, Walmart, HelloFresh, Magna, Purolator, and Air Canada. Mississauga, we are moving full steam ahead on a number of different fronts to get to our goal of vaccinating 75% of the region's adult population by the end of May. Last week's announcement from the province saw the government commit to spending 50% of all incoming vaccines to hotspots for the first 2 weeks of May. I really want to thank the province for doing this. It was vital. This has allowed Peel Public Health and our hospital partners to ramp up appointments and vaccinations significantly. To date, we have administered just under 600,000 vaccines, and we're doing more than 100,000 each and every single week, more than 15,000 each day. 37% of our adult population over 18 plus has received at least 1 dose of the vaccine. But we need to keep a steady and consistent supply of the vaccine flowing to Peel, especially now, as all residents 18 and over will be eligible for the vaccine starting tomorrow. I'm urging the province to listen to the science table and commit to sending hotspots like Peel 50% of all the vaccine going forward. COVID-19 has not affected regions equally, and returning to a per capita distribution of vaccine is insufficient for us, and it is neither fair nor is it ethical. I want everyone outside of a hotspot like Peel to understand that we're holding the rest of you up. We're holding up the province right now from getting their lives back to normal. The faster everyone in hotspots is vaccinated, the faster the rest of the province can return to the new normal. We need this to happen because despite all the great news on the vaccine rollout, Peel continues to be the hardest hit spot in the entire province. This week, Peel Region is averaging 348 cases per 100,000, down slightly from 363 a week ago. Mississauga is averaging 282 cases per 100,000, which remains about static from last week. The promising news is that it appears the curve is starting to bend in the right direction, and I'm very hopeful that this is the beginning of a steady and sustained downward trend. Our hospitals, however, continue to see a flood of patients. In Mississauga, Trillium is dealing with 127 COVID patients, 27 in the ICU, and 18 suspected cases. The situation is similar at William Osler Hospital with 113 COVID hospitalizations, 18 in the ICU, and 58 suspected cases. But these numbers don't paint the full picture of how devastating this third wave has been on our community. Both hospitals continue to transfer out dozens of patients each week to other hospitals across the province. This week, William Osler will transfer out 139 patients and Trillium will transfer 43. Since the start of the pandemic, the two hospitals together have transferred out almost 1,500 patients. Both hospitals are now receiving staffing support from outside the province. And while other hospitals across the province are beginning to schedule back their elective surgeries, the CEOs of both Trillium and William Osler have told me that they are still weeks and weeks away from seeing that happening here. As surgical nurses are still being deployed to deal with the high number of COVID cases. What's happening at our hospitals is a reflection of the high degree of community spread that continues to plague our region. We have to continue following the advice of public health as we ramp up our vaccine rollout. I also want to quickly touch on outdoor recreation. I made my views pretty clear over the last few weeks that I think the restriction on outdoor recreation should be lifted. This is also in line with the science table, which officially advised the province, or specifically advised, not to close down outdoor rec. We know the risk of transmission is incredibly low and that outdoor activities are essential to the overall well-being of both adults and children. City staff don't want to lock up tennis courts or put barriers on basketball nets. This was a provincial order to the city, and we were obliged to follow. I'm hoping that the province will consider lifting the restriction very soon, especially as the weather gets nicer and as cases plateau and begin to decrease. Before I bring up Dr. Lowe, I'd like to quickly remind people that our small businesses continue to suffer greatly because of this extended lockdown. Week after week, as we discuss the vaccine rollout and case numbers, it's easy to forget that many of our businesses are hanging on by an incredibly thin thread. They need your help. Please continue to support local businesses through curbside pickup and online delivery. If you're able, consider ordering in once a week. Today is Cinco de Mayo, so why not order in from a Mexican restaurant? If Mexican isn't your favorite, there are so many other amazing choices. Please visit tasteofmississauga.com to find a great list of local restaurants to order in from, as well as mississaugamade.ca. We need to support local businesses as they are the lifeblood of our communities. They are an essential part of our neighborhoods. With the end of this nightmare in sight, it's only a matter of time that we'll be dining out and shopping at our favorite spots soon again. But they need your help to survive now. In Mississauga, I've never been more confident that brighter days are ahead. Please get vaccinated when it's your turn. Please continue to follow public health guidelines. And to my mother, Veronica, I hope she's watching, and all the mothers out there in Mississauga, I want to wish you a very happy Mother's Day on Sunday. Please stay healthy, stay safe, Mississauga. And now I'd like to invite Dr. Lowe up to give his update.
Thank you, Madam Mayor, and good afternoon. Mississauga's weekly incidence rate for COVID-19 currently sits at 282 per 100,000 with a test positivity of 14%. There are early signs that our third wave is bending, but it is early days. And indeed, while the third wave in Mississauga and Peel started later because we stayed in restrictive measures longer, the variants have proved as powerful as the science table warned. Many of our residents, especially our most vulnerable, continue to get sick every day in record numbers. Some of them are then being needed to be hospitalized or treated in intensive care. And because our hospital partners continue to navigate significant pressures, surgeries remain canceled, healthcare providers continue to work around the clock, and patients in our community are sometimes being transferred to be cared for hours away. Regrettably, we also know that some of those who are infected will sadly succumb. While we advocate for those who cannot voluntarily reduce their contacts, it is essential that all of us do our part to reduce our own contacts and keep each other safe, no matter how tired we might be of staying apart and missing milestones. On the topic of milestones, I know that Sunday will mark a second virtual Mother's Day, and I hope fervently that it will be our last. I do want to thank all the mothers out there who are working double duty throughout this pandemic. Your sacrifices are making differences every day. However, our goal remains the same this weekend. Please do not gather. Reduce contacts outside of those that you live with already. Stay home as much as you can. Favor the outdoors, and always distance and mask when meeting with someone that you do not live with. Do not meet if it's not essential, and do not meet if you are sick. Get tested and self-isolate instead. Despite everything, I do remain hopeful. We're grateful to the province for the additional allocations received, which are allowing our vaccination program to move into high gear. And our goal is simple: get to 75% first doses across our community. That means what each of us needs to do is also simple: get vaccinated. We also welcomed the province's opening of bookings in provincially designated hotspots, but we have long believed that all of Peel should be prioritized. Rates in the neighbourhoods that are not designated as hotspots by the province in Peel are at times higher than the designated hotspots elsewhere in Ontario. For this reason, as Mayor Crombie has mentioned in her remarks, as of 8 a.m. tomorrow morning, we will be opening eligibility to all adults living in Peel over the age of 18. That is, born in 2003 or earlier. That is, all Peel residents 18 plus will be able to book into our mass vaccination system to receive vaccines, including those that live in areas that are not designated as provincial hotspots. From 8 a.m. tomorrow, you can visit peelregion.ca/COVID-19 vaccine to learn about your booking options. Our website will be ready. This message is simple. If you are 18 and you are a resident of Peel, now is the time to get your shot. Our collective goal remains 75% first doses, which is the level where other jurisdictions elsewhere internationally saw changes in transmission and hospitalization trends. Across our system, we are currently offering as many as 15,000 appointments a day, moving to almost 18,000 appointments a day across our vaccination system, which is equal to a full pre-COVID crowd at a Raptors home game getting vaccinated every single day. That means nearly 125,000 doses every week on top of almost 600,000 that have been delivered in Peel to date. Our goal of 75% is 1.2 million residents. So at 600,000 now, with 140,000 doses a week, it's simple math that in 4 to 5 weeks, if we manage to keep going at the capacity we've been going, we could hit that target. We are closer than we ever have been before, but it will take all of us in our region, hotspots or otherwise, doing our part. So, if you're 18 plus and you live in a hotspot, you can book right now on the provincial system. And as of 8 a.m. tomorrow, all residents in the region of Peel, 18 and older, will be able to book. Visit peelregion.ca/COVID-19 vaccine for further information. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe, and this is perhaps one of the more exciting of our press conferences with terrific news, and we're happy to take questions from the media.
Mayor Crombie, your first question comes from Laura Stone at the Globe and Mail. Go ahead, Laura.
Oh, hi, Mayor. You mentioned you want the 50% allocation to continue. The health minister said today, essentially, they're only doing it for the next 2 weeks, and then they're going back to a per capita basis. Can you respond to that? And how are you going to convince the government to keep sending more vaccines to Peel?
Well, I'm going to convince the government to do the right thing, because clearly the rest of the province can't get back to normal until we address the spread of the virus here in Peel, and we can't do that unless we have an adequate and steady, reliable stream of supply of the vaccine. It's vital here. Now, we only have 3 or 4 FSAs, postal codes, that are not deemed to be hotspots. And yet the hospitalization rates and the case count rates in those hotspots are higher than other regions that are other hotspots across the region in other regions across the province, Laura. Sorry about that. So we're going to tell them that we need to get through this, and the rest of the province won't get through it until they continue to send us a steady supply of the vaccine. And 2 weeks is not adequate. I think they need to continue to do it for the foreseeable future. I'm not alone in making this request. The mayors of the region of Peel, as well as the science table, is advocating for 50% of the vaccine to Peel region. It is the fair thing to do, and it is the moral and ethical thing to do as well. I don't know if Dr. Lowe would like to make a comment. He is nodding, Laura, that he'd like to make a comment as well.
Thanks, Madam Mayor. So certainly there is a recognition of some of the challenges that we face in the region of Peel. Almost 85% of our population, actually closer to 90%, I believe, when we actually crunched the numbers and realized that many of the postal code FSAs, 3 of them are actually around the airport and are considered sparsely inhabited. The vast majority of our population already lives in a hotspot. So this is really about clarity and communication and messaging. If you are 18 and a resident in Peel, now's your time to access vaccine. And certainly to the extent that the supplies coming from the province are very welcome, we very much appreciate our continued collaboration with our provincial partners. We are hopeful that the continued ramp up and this announcement will allow us to get to that critical level to really see changes in transmission and hospitalization that will keep not only Peel, but hopefully the entire province of Ontario safe. Thanks for the question.
Dr. Lowe, I believe the follow-up was for you as well.
Yeah, hang on. I just want to make one more comment to Laura's, if I may. We're home to the essential workers, Laura, here in Peel region. They live and work here, and they're in every corner and every pocket of our city and in our region. So, given that we are a hotspot, the entire region is a hotspot. So I'll leave it back to Dr. Lowe. Thank you.
Thank you. Dr. Lowe, I just wanted to understand, so the non-hotspot residents can book directly through Peel, but the hotspot residents still have to go through the provincial site. Can you explain why you're not opening up the Peel-specific website to everyone, including those in hotspots?
That's a great question, Laura. So it's an issue of scale. So we know that the vast majority of our population lives in a hotspot designation, and for the purposes of clinic efficiency and for the purposes purposes, because basically everything that gets booked through the provincial system ultimately ends up directly in front of the vaccinators and the registration. So it's for an efficient, seamless process. We really would like to encourage everyone who still lives in a hotspot to respect the provincial booking system and that aspect of it. But we do recognize that we have some capacity through the Region Appeals booking system, which we had previously used to book priority groups such as our healthcare workers, our Indigenous adults, etc., and all the other various priority groups, teachers, etc. Well, teachers were actually booked through the provincial system. But anyway, there were a whole list of priority groups that we worked through in phase 1 that we had our own system for. It has now been repurposed to ensure that we can get to, I think it was about 50,000 residents who lived in non-hotspot areas, and therefore putting in a certain proportion allocation of appointments to those areas as well, to ensure that they can also access this protection. So that's why we're asking people, for the purposes of clinic efficiency, if you can book on the provincial system, please continue to book on the provincial system 18 plus hotspot, and then there will be further information on our website as to how, if you don't live in hotspot, you can still ensure that you're able to access a Region Appeal clinic. And of course, our 2 hospital systems as well continue to maintain their own systems, and people can also access those 18 plus in Peel throughout as of 8 a.m. tomorrow. Thanks.
Next question.
Your next question comes from Sean Lathong at CTV News. Go ahead, Sean.
Welcome, Sean.
Hi there. This question's for Dr. Lowe.
Sure, no problem.
Hi, Mayor Crombie.
Hey, how are you?
Yes, Sean, go ahead with your question. Thanks.
Dr. Lowe, can you comment on the announcement coming out of the province today that there will be more mobile vaccine units soon rolling out to essential businesses? Do you know what that will look like for Peel?
So yeah, I've certainly understood from the province that they were setting up those programs. They were recruiting vaccinators, providers to participate in them. We haven't received any further details as to how they will support our efforts here in Peel, but we've been very grateful for the partnership with our provincial partners in trying to get through. I think they have really prioritized essential workplaces. They've been very supportive in providing additional allocation for our workplace pop-up pilot, and I am certain that we will continue to hear more information about their mobile workplace program that they've just announced as well, and how it will continue to support our efforts here in the Region of Peel. Thanks for the question.
Follow-up?
Yeah, on a broader sense, can we get a sense of what this rollout will look like to everybody? Will this all be done at mass clinics, or will it be done at pharmacies, a combination of the two?
With respect to the employer workplace clinics, Sean?
Sorry, with the rollout to everybody 18 plus, is there?
Yes, it's a
will this all be done at?
The mass vaccination sites, there are 5 of them. They are at 7120 rather, here in Ontario, north of Derry, the Paramount Fine Food Centre, the International Centre, Trillium Health Partners, and UTM, which is also run by Trillium Health Partners.
Your next question comes from Sean O'Shea, also at CTV News. Go ahead, Sean.
Hi, Mayor Crombie. It's
Welcome,
Sean O'Shea, Global News. But
Global, yes. Oh, I know.
Mayor, I just wanted to ask, I'm reporting a story tonight about a party that occurred at the Canada Post Gateway plant on April 3rd, on a day when 4,700 and some new COVID cases were announced, and at a location that Peel Public Health ordered shut down on one of its shifts. Mayor Crombie, what's your opinion of a retirement party with no distancing, people enjoying pizza and a party in an environment where so many people have become sick? I'd like your opinion on that, please.
Sean, you are painting an incredibly irresponsible situation. I am extremely disappointed in the workers over at Canada Post. They've already been subject to a number of shutdowns, of closures, partial closures. We've had public health investigating the situation. This is incredibly irresponsible behavior. It really, truly disappoints me. And I thought you were here, you were going to ask me why Canada Post hasn't been offering the vaccine to their employees, and I think we should ask them that, and why aren't they offering an employer site to all their employees? This is shocking news, Sean. This is incredibly irresponsible. If they had a house party, there would be no different. We would have been over there and ticketing it. I've got Sam Rogers here. I don't know if you want to comment. Note to Dr. Lowe. Either of you want to make a comment? No. They say, I've got it covered. They all feel the same way. Incredibly irresponsible.
Follow-up, Sean?
No, that's fine. Thank you, Mayor. Appreciate it.
Okay.
Your next question comes from Steve Cornwell at the Mississauga News. Go ahead, Steve.
Hi, Mayor Crombie. How are you?
I'm very well. How about you, Steve?
I'm well, thanks. I was going to ask maybe for you and Dr. Lowe,
Sure.
with the 18 plus being allowed across Peel, and maybe you could field it for Mississauga, do we have a sense of how many more people will be vaccinated over this period of time? Like what the scale of this kind of opening means in terms of potential residents being vaccinated?
You know, you cut out a little bit, but I think you're just asking how well will it be received, and I think incredibly well. This will mean the balance of our postal codes, those that weren't considered hotspots, will be able to register, and that's incredibly good news. We know that we're booking about 12 to 14 days out right now, May 17th and following, and depending on the time of day you call, you may have a little wait or no wait at all. So we think the vaccination sites have been incredibly well received, and as have the few pop-ups that we've operated as well. I think this is incredible news for Peel, but even better news for all the residents of Mississauga.
Thanks. I was more interested in the kind of if we had a sense of how many more people could be vaccinated.
Dr. Lowe is going to respond.
Also, and just to follow up on that too, like in terms of the capacity piece, we've seen that Trillium Health Partners, they booked all of their appointments up until May 17th.
That's correct.
Is there additional capacity coming online to accommodate kind of more people getting the vaccine?
Yes, there is additional capacity, and I believe there's going to be extended hours as well. Why don't I let Dr. Lowe respond to that as well?
Yeah, so thank you, Madam Mayor, and thank you, Steve, for the question. This announcement opens up the opportunity for vaccination to around an additional 50,000 residents, which, if you do the math, we're doing 12 to 14,000 a day. It's essentially 4 more days worth of vaccination in our campaign for a lot more clarity in terms of our operations and our messaging to our residents. 18 plus Peel, visit peelregion.ca/COVID-19 vaccine. Figure out how you can book based on hotspot, not hotspot, and go ahead and book. So I think that speaks to your the population question in terms of how many more people are now eligible. And it also, by the way, this resolves a lot of the issues around prioritization of, which group, where, medical conditions. Now anyone now has the opportunity to book. However, we do continue to work with primary care partners and community outreach, community ambassador partners to make sure that priority groups are actually supported in booking and also being targeted for very limited pop-ups that are not necessarily open to the public, but are really trying to get to community groups that face significant barriers to get into our mass vax clinics, such as on-site workplaces, such as in certain communities. So that's kind of how the overall plan is going, but it is really opening up just 50,000. And then, as Mayor Crombie mentioned, there are enhancements that are coming to all of our clinics. 2 of our clinics, one in Brampton, one in Mississauga, have moved to hours. They were at 10 to 6 and 12 to 8:30 originally. Now they're moving to basically be open from 7 till 8 and 7 till 6. And then next week they will be moving to open from 7 a.m. till 11 p.m. In addition, we are also reconfiguring a number of our clinics to improve flow and efficiency. And overall, that will continue to bring online almost an additional 5,000 doses worth of capacity each day. So with the allocations, with this clarity of announcement and applying 18 plus all across Peel, and the enhancements that are planned in our clinic, we are hopeful that we will continue to grow ever more towards that goal of 75% first doses here in the region of Peel. Thanks for the question.
Next question, please.
Your next question comes from Sumit Dami at Omni Television. Go ahead, Sumit.
Welcome.
Hi there. Thank you so much. Thank you. And my questions will both be for Dr. Lowe, please.
Sure, no problem. We'll bring him up.
Hi, Sumit. Thank you.
Hi, Dr. Lowe. Hi. So the pop-up clinics, which are being facilitated through the MOS and the Gurdwara, experienced some really great engagement, as Mayor Crombie said earlier. And you did mention the one in Malton, which we'll see this Friday, and that you really want to ensure that it's not promoted too much so that way it really reaches the people who need it the most there. So I'm really wondering what this communication will look like. Will it be the grassroots communities, like talking directly with their communities, or what will we see?
That's correct, Sumi. That has been really the fundamental difference between our pop-ups here in Peel as well as compared to pop-ups elsewhere. Our pop-ups are not intended to be a free-for-all, come stand in line, all comers. We've now been able to actually resolve that problem by moving to 18 plus throughout our mass vaccination system, and can now push all comers through our online booking systems to get into a mass clinic. We also have booking and transport networks that are actually supporting people who face barriers in that front to get to our mass clinics. And so you are right that the pop-up clinics we have are really focused at getting to the hardest to reach, the people who face the most significant barriers, either due to specific reasons or beliefs or circumstances. They are unable to attend at a mass clinic. And so it is working directly with those community agencies, with those community groups, and then really going through the grassroots. It's a bit of a longer, less efficient process. And so this really speaks to, in Peel, our view has always been, and as I've said at this podium many times, the vast majority of people, the backbone, the capable folks who are capable of attending at a mass vaccination clinic, able to attend at a mass vaccination clinic, and then those that aren't able to, we are coming for you through workplaces and through these kind of community outreach pieces, recognizing that those barriers need to be addressed.
Follow-up?
Thank you. Regarding second doses, so in today's City of Toronto press conference, they said that the scheduled second doses there will begin the week of July 7th. Speaking to some elders who were kind of on the first of the list in Mississauga and Brampton, I know that it's about the similar timeline as well. But with the increased shipments, is there optimism that those elders will start to get their second doses a little bit sooner than July 7th?
Well, at this point in time, I think our focus is really on trying to get first doses, as I've mentioned. The goal is 75% first doses, and with the announcement today, 18 plus in the region of Peel, now is the time. If you're an adult 18 plus that lives in the region of Peel, time to get your shot. Visit peelregion.ca/COVID-19 vaccine. If you're in a hotspot, you can book right now. If you're in a non-hotspot, once our system goes live as of tomorrow morning at 8 a.m., you can go ahead and book. And then we'll see where things land there, as well as with the supply and allocations, and to revisit the second dose question and timeline. But you are correct, Sumit, it is a similar timeline for us in the region of Peel at the moment. Thanks so much.
Thank you.
Next question, please.
Your next question comes from Isaac Allen at The Pointer. Go ahead, Isaac.
Welcome, Isaac.
Hey, thank you. I want to ask about the MZO film request from this morning.
Oh, okay.
Staff request. There was a staff report, from January that said that, quote, staff and councillors have been receiving an increasing number of inquiries for site-specific MZO requests. And it points out that an MZO request can set a precedent. So I want to know, with that motion passed today, are you concerned that this approval could lead to an increase in the number of MZO requests that council is having to consider having these tough conversations about the planning process on a more regular basis?
Well, you're absolutely right. We have taken a position that we don't agree with MZOs generally, only for specific usages such as affordable housing, long-term care, seniors care, etc. So when it's not including market value housing, for special use, we would consider it. And this was a special circumstance in that they're very eager to get this film studio up and built. They've made commitments, and without it, it would take an ordinarily of 8 months to a year, and they need to move on it rather quickly. So we have not had a great track record of success with MZOs, but we've only asked for one at the region that we didn't receive, and we've received two here at the city, one that the hospital requested and one that came forward for what we had thought was going to be affordable housing or seniors long-term care, but for market housing. And you and I both know, Isaac, that we don't need any extra encouragement for market housing here in Mississauga. We have for 20,000 units in the supply chain, in the pipeline. So this was a special circumstance. So in highly specialized cases, we may ask, and this was one of them because, as you know, we have 8 film studios right now, and this would be the newest one, and we're quite excited about it. It'll be quite a prominent and premier location, and they're very eager to meet commitments and get it built. And our staff advise us that this could be 8 months to a year to rezone it, and the quickest way is to ask the minister for that MZO.
Follow-up?
Yeah, I mean, as you've hit on there, the justification for this request is essentially economic and it's job creation.
Correct.
And I suppose the thing about an MZO is that you can make an economic argument for almost any development project, even just in the case of the number of construction jobs it'll bring and things like that, which is part of the presentation that was put forward last week by the studio, was the number of construction jobs, as well as the jobs it would bring when it's built. So what specific rules or steps will you set out to make sure that people are really clear on what is a special circumstance and what isn't,
right,
so that it's not a matter of opinion every time?
Yeah, you hit the nail on the head. So this is a very special circumstance. We as a council don't believe in asking the province for MZOs because typically they're requested for market housing. And of course, we know that we don't require market housing or any encouragement to build market housing here, but we would in cases where there are special circumstances that are job creation or if it's affordable housing related or seniors or long-term care related. Those are some special circumstances in which we would justify. But certainly just construction or market value housing wouldn't cut it for us as a council.
Your next question comes from Pooja Luthra at Y Media. Go ahead, Pooja.
Hi, thank you so much for taking my question, Mayor.
Welcome, Pooja. Thank you.
Thank you. I would like to know what is the feedback you are getting from small businesses? Like, how are they able to sustain in this COVID situation?
Oh, goodness. It's heartbreaking, the feedback we're getting from our local retailers, from our local restaurants, from our personal care providers. They're devastated. When I walk along Lakeshore and Port Credit, because I live nearby, we see so many business units that are now boarded up or paper in the window, for lease signs in the windows. And it's heartbreaking because these are members of our community. They're our friends, they're our family, these are entrepreneurs, these are people who give back and contribute to the city of Mississauga. And because of this pandemic, this virus, many of them have their life savings invested in their businesses and they've been forced to shutter. And I think also about those primary care providers, many are female-run businesses that are providing for their families, and we know that this pandemic has hit women harder. In fact, it's been characterized as a she-session, and we know that 1/4 women are thinking about leaving the workforce as a result of the pandemic. So it has had very dire consequences, and notwithstanding the financial supports provided by the federal government and the province, they don't go far enough.
So, Mayor, my question would be like, how is your government, making sure that they're able to get the financial support which they need at that time? Like how you are advocating that?
Yes, so certainly we are advocating. We do to every level of government all the time, whether it's the big city mayors of Canada, the Ontario big city mayors, the GTHA mayors. We're always advocating, and we've made it clear to our businesses who we've had numerous, I think over 60 town halls, roundtable discussions, along with our economic development team and their office. They've provided guidelines, they provided guidance, support. We have websites up that show businesses where they can go for further support. But unfortunately, at the municipal level of government, we're in operational deficit as well. We're not permitted to run a deficit. We're not permitted to provide financial grants, subsidies, or loans. It's against the Municipal Act, and so we're not permitted to do so. So our role is strictly advocacy and providing support, and certainly guidance as well. Our economic development team has been holding webinars and training and providing assistance to many small businesses throughout the pandemic.
Your next question comes from Ashley Newport at Mississauga. Go ahead, Ashley.
Welcome, Ashley.
Hi, Mayor Crombie.
You must have been pleased
Thank
about
you.
the discussion at council today since you asked last week.
Which one was that again? There was a bunch of discussions. Was it?
Pilot project on the hens?
Yes.
The urban.
That's exciting. I think it's exciting.
It is exciting.
But it is. But my question today is actually not about the hens. There's been obviously a lot of big announcements today about vaccines, especially now that everyone 18 and over in Mississauga can book starting tomorrow, which is huge. And then, of course, before that, the province announced that there's going to be more workplace pop-ups in Peel. And they also announced, and so did the region, that a number of new workplaces are also going to be hosting their own vaccine clinics starting this month. So I'm wondering actually what's happening with the the Peel-run mobile vaccination clinics, the ones that were proposed by Councillor Parrish a few weeks ago, with so many workplaces running their own clinics, and now with the province also running workplace clinics, is Peel Region planning on doing its own mobile workplace vaccination clinics, or is there going to just be too much overlap now if you have clinics run by the province, the workplaces, and the region, or is the region still planning on launching its own mobile clinics in the future?
Right, so I'm going to let Dr. Lowe respond, but for the most part, employer-run clinics have to apply to the province, and it's a different allocation of vaccine. Dr. Lowe has been running pop-up clinics and mobile clinics to those who are homebound, those in congregate settings with seniors care, long-term care facilities. They have been running mobile clinics throughout each wave of the pandemic. Recently, there have been culturally specific pop-up clinics that target the most marginalized, most vulnerable populations who were least likely to attend at a mass vaccination site. So I'll let Dr. Lowe come up and respond to the balance of the question. Thank you, Ashley.
Thank you, Madam Mayor. Thank you, Ashley, for the question. I think it's really important to highlight that the mobile vaccination clinics and those in workplaces are, while the province selects them, Peel Public Health is involved in just advising and directing, and then the community clinics that come out of those workplace clinics are also places where, while it is meant to be largely run by the employer, we have had some involvement as well. Our mobile clinics also continue and has really continued to focus on vulnerable groups within our community, the cultural outreach that Mayor Crombie alluded to, but also our homebound and our seniors congregation. So the reality is that there's a lot of mobile that's happening. All of that mobile is meant to supplement what's going on in the mass vaccination clinics, and to the extent that we are trying to get to the workers and the people that were identified in that motion through whatever modality we can, our focus is really on making sure that we are delivering and protecting that population as opposed to deciding who, where, and how it's being done. Thanks for the question.
Next question, please. I'd like to actually make a clarification, Dr. Lowe. You may want to as well. I'm told that there's a story running that the province has extended 18 plus to all regions. That is not the case that I'm aware of. Dr. Lowe has opened up 18 plus to all of Peel region. I think there's a distinction in the coverage. Am I correct, Dr. Lowe? Would you like to make a further clarification? He is nodding his head that this is not a province initiative. This is a Peel initiative opening up 18 plus to all residents of Peel. Next question, please.
Ashley, follow-up?
Oh, yes. Thank you very much. And then on a completely different note, I know the city recently announced that it was exploring ways to increase housing choices in Mississauga by looking at ways to, add more basement or secondary suites, or, permit the construction of more duplexes and triplexes. It made me wonder, I know a few weeks back, Acorn called on Mississauga to create an enhanced bylaw system, a model after Toronto's rent-safe landlord licensing program. They were claiming that Mississauga isn't quite able to crack down on landlords who might not be tackling issues in buildings and houses such as pests and other issues. Since the city has been pushing for a long time for more affordable housing and better housing, and since we know that it's difficult for renters in many cases to find affordable and comfortable units, is a special landlord licensing program something that the city would or is considering at any time?
Yep, I'm always grateful when one of those questions come forward, and I give Sam Rogers, who our Director of Enforcement, an opportunity to respond. So I'm going to pass the microphone over to him. And you know well that we are the only city that has created a strategy to build more affordable housing for the middle class. So let's just start there. And Sam, he's going to come over and respond to you, Ashley. Thank you.
Hi, Ashley, and thanks for the opportunity, Madam Mayor. It's nice to speak to something other than COVID enforcement. So yes, we were directed by Council back in late 2019, early 2020, to review and report back to Council on the feasibility of an apartment building minimum standards and maintenance program. So really what the equivalent of the rent-safe TO program is. That work has been delayed because of COVID and our capacity, resources, and pressures to enforce everything involved with the pandemic. However, I am pleased to let you know that we are finalizing our public engagement plan right now, and we will be announcing the launch of that very shortly. So late May, early June, we plan to run an engagement with stakeholders like Acorn, like you mentioned, of course, landlord owners, and most importantly, tenants, to get everybody's perspective on what they need, what they see as the issues, and what kind of value the city could offer on all those fronts. So public engagement will be next, followed by a report that will be on the feasibility of a rent-safe TO, but made in Mississauga, made for Mississauga program potentially in the future. Thanks.
Next question, please.
Your final question comes from Khaled Salama at My Second Home TV. Go ahead, Khaled.
Welcome,
Hi, Mayor.
Khaled.
I'm happy you are happy.
Oh, I'm having a great day, Khaled. Thank you for joining us today. It's great
My pleasure.
news.
Thank you. Yes, of course. If all scheduled vaccine shipments and supplies goes as planned, how long it will take to vaccinate all residents of Peel? And would you consider loosening the restrictions right now by summer, like New York and the States, for instance?
Yeah, so once we achieve that herd immunity, there may very well be a loosening of restrictions. Why don't I let Dr. Lowe speak to how quickly that will occur? Okay, thank you.
Thank you.
Yes, thank you, Madam Mayor. Thank you, Khaled, for the question. It allows me to sketch out the roadmap a bit clearer. So the first step and the first milestone is to get to 75% first dose coverage in our community. That's the level that other jurisdictions like Israel, like the United Kingdom, like places in the United States have managed to get to and have therefore then seen changes in transmission hospitalization patterns. So, when that comes really depends on all of us, our ability to get out there, roll up our sleeves, take our shots, and we now have that opportunity with 18 Plus open in Peel. I encourage everyone to go peelregion.ca/COVID-19 vaccine, make an appointment, get your shot, be part of the collective solution to really take back control from the virus. And then, of course, once we get there, there's a monitoring period to see if the vaccine coverage is having its effect, and then subsequently, together with the rest of the province, because this isn't something that will happen alone in Peel, we will determine what happens and how we start to emerge from this unprecedented human health crisis. The next step, of course, though, is once we even start gradually loosening restrictions, you would still need to monitor to see what would be happening with trends to make sure that things still look good, moving forward cautiously and gradually, while you are also still steadily getting second doses in. And then once you get to something like 75% second doses, that's where you get to what is known as herd immunity, the hope that you've actually interrupted transmission altogether in the community. There is a lot of discussion around whether that's a viable target, whether we're actually going to reach it, but either way, the path out of this is still clear. We still need to have as many people vaccinated as much as possible, first to 75% first doses, maybe some gradual loosening of restrictions, and then hopefully to get to 75% second doses in the future to really ensure that we get back to some sense of a life more ordinary. Thanks for the question.
Thank you, Doctor. And my second question is, any updates on the half boxing gym? Because latest update, I believe it was a little bit difficult to deal with this situation, especially we have other stories from other places. They are open and they are defying, and they say normally nobody can do anything for us.
Yeah, you raise a very interesting question, Khaled, and we don't appreciate when businesses flaunt the rules like that and find loopholes to operate normally when only special circumstances are permitted. So why don't I invite Sam up? He's going to give you a briefing on where we're at, but we will be laying charges. Thank you.
Thank you.
Before I provide an update, I just want to clarify, this is, not a standard process to sort of provide details of an ongoing investigation. However, me and my team really decided to make the exception here and provide you with, what the status of what is an ongoing investigation, because this is such an egregious and standalone outlier kind of an issue. So by way of update, last Thursday, the first round of Part 3 charges were laid. Summons were issued to the business owners. Following that, we proceeded with another round of investigations and inspections, and as a result, 2 new Part 3 charges are in the process of being laid. So that right now has us at 6 Part 3 summons to the business owners, each representing a maximum fine of $500,000 and a year jail time. That's happening right now. Concurrent to that, though, the Ministry of Labour has been involved. So they have assigned counsel, and they are reviewing the status of that file and are looking at what further legal action is appropriate in this case. And that could include court orders, court injunctions to escalate enforcement options even further. And then finally, we are continuing to monitor with Peel Police. Public safety remains a big concern. Thankfully, there haven't been any large-scale protests or a lot of other people sort of getting on board this. We really are seeing this as an isolated situation. The vast majority of all businesses have complied. In the gym community, everybody else is complying. So this has not become a systemic issue. It is really isolated, and we are using all of our enforcement tools to the maximum in this case.
Sam, excuse me, just for asking, is there a black and white? Can we close? Can we not close? Is it an issue? Is it not? Do we have the force? Do we not?
So there are options to close that would compromise public safety. And at this point, that's a question better suited for the police. I fully support their decision not to employ those more, use of force tactics, if you will, because that's what would be required right now. We do not have the authority today to change the locks and seize the property. It would be more about not allowing people to come and go from the premise, and that would risk public safety concerns. I'll hand it back over to Mayor.
That was the final question for today. I thank everyone for joining, and we'll see you next week.